they're not aware of sickle cell disease. And so my question is there a team that you've got that can go out to these schools to help with educating them in learning how to deal with these students with sickle cell? I did manage to get through to my daughter's school in terms of getting them to give her a toilet pass, but even with that toilet pass, some teachers still do not allow her to leave and go to the toilet. So is there anything you got in place that could help with educating these teachers?
So the best sort of service we have to be able to do that is through the community teams. Now should we get them to... guys, at the back, can we quiet down a little bit just so these guys can hear us? Okay. Cool. So generally with the schools, it's the role of the nurse specialist or the community nurse specialist to liaise with those schools. So if you live in London, there's quite a few different community nurses that cover different boroughs. However, some just are a bit of like a black hole. For example, there's nothing there apart from the hospital nurse specialist. So I would always suggest that speak to the nurse specialist at the hospital or in the community if you have good links with them. And we can always go to that school and sort it out. I've been to quite a few different schools, and unfortunately it's still the same. You speak to the schools, you speak to the headmaster, headmistress, whatever, and they still just ignore it. Yeah?
I'm just really curious, I'm going to pass back to the panel. This is something that we hear in clinic a lot, that education, lack of awareness around sickle cell within schools is a real daily grind for you guys. It's something that we're looking as a network to do a piece of work around. Could I just have a show of hands for people that strikes a chord with? That school and education and awareness is a priority issue for you guys. Do you mind if we just take a picture just so that we've got a show of hands? Keep your hands up, and are we coming? And thalassemia as well. So yeah, either conditions, if we can just capture that, because this is really helpful for us to set priorities working with you for improvements that we can try and make.
So every child with either sickle cell, thalassemia, or the rare anemia should have a school care plan, and that is something that should be transferred, adapted from primary school to secondary school. But apart from that, I think the general point that you're raising is about the education in the schools, and that is where maybe sometimes things fall apart, because that I think collectively as health professionals, whether we are psychologists, nurses, or whatever, we need to have an input. And unfortunately, children with these conditions don't have a special educational needs sort of support as it should be. It's not automatic. So you have to work on an individual basis to try and address these things. And I think collectively we probably need to do more in terms of education for schools and so on.
Okay, so, sorry. I was Director of Student Care in my previous role. The people you need to work with are your special educational needs and disability coordinators, not the head teachers, not your form tutors, special educational needs and disability. Now, not all of them are helpful or no. Okay, I know this. So, point one, you go to them. As somebody who not only has sickle cell, I also have ADHD and various things. I know this, I know. There are the following things. On the network page, the Red Cell network page, there's an education section and guides. Those can be sent straight to the Senkos, and it has advice and it shows exactly what children deal with. At the back is the Living with Sickle Cell guide, which I also supported Stuart and the team putting together. Take a copy to the school. Let them digest it, let them understand it. And then the other thing is link them in with some of the charities that offer the free training. I know it's a hassle, I know it's hard work, but this is what we have to do. It's about advocating and it's about leading the way, because once you put that pathway in, you're helping every child that then follows yours.
Can I just add something really quickly? In Haringey at the moment, we have started actually school nurse education, and Senko's can join. And this was actually not just for sickle cell, it was for lots of children with chronic illnesses. So the diabetic team, the sickle cell team were all there. So we invited all of them to come and actually be educated on the day about these different conditions. So I think that's another way in the borough whereby we can be able to educate the school nurses about these different conditions and what they need to do.
I am also happy, so I'll share my details, to come in and support schools, both from an advocacy point of view, but also from an education perspective.
We've got, so Stuart's got a list of, he's creating a little queue, so there's just a couple more at the back.
Can she go before you?
Dublin,
She's burning to go.
EKA. It's not working.
Hi everyone. My question is to the NHS. I work with the NHS as a sonographer, and I am a mom to an SS, and I've on several occasions, this disease is the pain your child goes through that really leaves you very traumatized as a patient, and then as a mom or a parent. And I just want to know, are there any specific pathways or guidelines written down for how to manage the crisis, the pain? Because I feel like these kids are being handled like it's a regular pain, where you go to hospital and you're just supposed to be given paracetamol as the first pathway, and then this, and because these are chronic illnesses, we've been home and we have been giving paracetamol, ibuprofen all through the night until you're like, your child can't handle anymore, and you call for the service or you go to the hospital, and it's very disappointing to reach the hospital and they're still giving like paracetamol and ibuprofen. I had to, you just wonder why I'm in the hospital, because is there really something that the medical team aware enough about this, how to manage the pain for these patients?
Okay, so
and then again to Ben, because I just want to ask or wonder why the consultants are not very encouraging in educating us about the stem cell or the donations for the sickle cells, and they're discouraging it. Because my son, since day one, I've been aware that I have to look for a donor to, because the disease is just, something that disorients you, leaves you traumatized as a parent. I don't know how the child feels, because they're young, but at one moment you feel like they're in pain and they're traumatized. And then if you have children that don't have this disease, they feel abandoned. So it's like you're in different places, all of you, the three, which is, and when I spoke to my consultant, she was like, she's like, the hydrocarbamide works, that this works. I'm like, but there are still long-term effects for the drugs. Why are you encouraging me to keep on the hydrocarbamide when there is, a cure I can try?
So a good question. And, two questions then. One around pain management. Who would like to come in?
Is there less education about the donations, which is really a positive and the right step to to reduce all these things?
Okay, so first question about pain management and protocols for paediatric pain management, how we approach that. And then a second question maybe about eligibility for transplant. So who should we be thinking about being eligible for a transplant or gene therapies? Who would like to come in on the pain? Sorry, I'm just being asked to make another announcement for the people at the back of the room. I'm really sorry, but if we can try and keep the noise down a bit. I know that people in the middle of the room here some people are struggling to hear. Thank you. Sorry, who wants to come in on pain then? Pain management, yeah. Pain pathways and protocols.
Lots of different approaches. One of the things that I regularly do is suggest that parents familiarise themselves with the NICE guidelines. So NICE are the guidelines that all hospitals should follow, and that's where the 30-minute access to analgesia came about. So if you familiarise yourself with that, you can download it, it can be on your phone, 1. 2, the other one is work with your clinician to have a care plan. And that care plan you take with you wherever. So you may be, so I know that my brother was in Oxford, for example, and had a crisis and ended up in hospital there. He's treated in London. He had his care plan with him. I know that Noemi just mentioned the black cards that you can carry. I have an issue with those, but anyway. Some of them are printed on, some of them are not. You should have all received them if you've got sickle cell. The idea of that is it just raises like a flag that would be on your care plan, and it gives them an idea. I know not everybody adheres to it and follows it, but these are the things that you go tooled with. I know patients that have a file that they have at home in their emergency bag, and it has examples of the treatment processes that were undertaken when they were last admitted. If you have these in these conversations, they can help. The other thing is, if they don't, and they don't act in the way they should, go to PALS, and in your complaints, make a recommendation that they get upskilled and educated via the Red Cell Network, which has all the videos about full clinicians that show you the pathway and the treatment options. The other option is to use the charities that are around that also support, so the Sickle Cell Society. I know we've talked about thalassemia as well. These are tools in your arsenal. They're not the answer, but they are there to equip and support you. And the more you know, the more you can then advocate. And I know it is difficult.
Just say one thing. So the Sickle Cell Society, there's something called a parent's handbook, and that's something that if you read that, you will know what to expect in terms of all the different types of complications and pain. And I don't know if you've had a copy of that. Yeah.
This is not about someone that has access to the handbooks or something. I want to be a parent that goes to the hospital and my son is treated, with urgency, because this person I'm taking to the hospital crying. This happened to me, and I started giving my son paracetamol to the extent of overdose, because I thought, it would, at one moment calm down, and it never did, from 1 a.m. in the night, and I ended up in the hospital like around 10 a.m. in the morning, and I was disappointed that I had to speak to the doctor and ask, why are you giving paracetamol to my son, after me telling you this is not about the school, how do you call it, the one you write down, the one we call the care plan. This is not about the care plan, because the care plan is speaking about giving paracetamol, but this is a complaint that has happened. I'm not from London, unfortunately. It might be better management in London, but I'm speaking for the NHS in England and everywhere else in the UK. This is a complaint from the mothers. We are crying. We are crying. We are giving our children paracetamol, ibuprofen, because this is what we have been told to give. And we don't have access to the Oromorph because we can't. That has to be regulated. And then I'm going to the hospital. What has the NHS England done to teach the doctors elsewhere, not in London necessarily, because we are widespread? And what have they done to improve? on the management of the crisis. This is not the nice guidelines. This is not the one. I'm trusting a doctor with my child, and I want to know, are they aware of how to handle my child? My child nearly died, so I'm speaking from experience.
I'm so sorry.
It is hard, and I hear you all. I don't live in London anymore. I'm in Cambridge. I'm treated by Dr. Besser. I know it. Thank you. Yeah. I know it is hard. I get it. I understand it. Okay. The education and the training has changed. So when I started teaching, sickle cell was what was used to teach about inherited disorders, and then it switched to cystic fibrosis. So that education gap has existed. Any rare disorder, and actually technically sickle cell doesn't come under rare because it's got more than X number, but it's still understood, discussed and worked. There is work that is being done. So myself and Dr. Besser, we regularly talk to doctors, teach doctors about sickle cell, how to treat individuals and patients. I've done the same with physiotherapists and various other things. So there are people out there who are fighting for you. You are not alone in this. It is slow, it is steady. If you are in the east, whereabouts are you? Bedford, east of England. Dr. Besser, Dr. Besser at the moment has been, pulled in as a specialist in the east of England. If you are concerned, you can ask the clinicians to contact regional contacts.
I'm sure you know how long and the protocol.
I'm really sorry. I'm sorry. Just to say, we're all going to be here all day. Please, if you don't have a chance, I think we've got 1, 2, 3 questions. People lined up. Yes, yourself and. We're going to be around. Please, we're very happy to discuss these things, to talk about these things. I would say, please use that voice. We as a network are really trying to hear from you what the issues are, what's your experience of care. We're trying to do some deep dives, some focus groups with parents, with young people. We want to know. We can't try and help and support that, but there is masses of work going on across the network, and we're really happy to talk about that, but I do feel like we need to bring in some other people because we are running shorter on time. So Stuart, in terms of running order for questions? Yeah. And then 1, 2.
So I have a ruptured spleen, and I would like to know if an enlarged spleen, but I would like to know if there's any possible things that I could do in my life to minimize the size of the spleen.
Okay, great question. Okay, so
Can I just add to that? Sorry, she has not been hospitalized very often, and she was hospitalized in the summer with a hemorrhaging of the spleen.
Okay.
And it was recommended that if this should happen again, it will have to be removed. So I think hence her question.
Okay, so a question around the spleen and enlargement of the spleen in sickle cell. Who wants to come in on that? Is there anything we can do to prevent splenic sequestration? I think is the main question. Does anybody want to come in on that, or do you want me to? Who wants to? No? Okay. I just wonder, what do you know about why your spleen has got big?
I don't really know any information about... infection, thank you.
Okay. So the spleen is a really important organ. It sits up and under your ribs on the left-hand side. It's important because it's where some of your immune cells live, and that's why we've been saying it's important for fighting off infections. But it also cleans your blood, breaks down your blood cells, etc. Now, when you have sickle cell, if you get sickling in the spleen, it's really common. And that's one of the reasons why the spleen stops working, because it gets scarred and it can't work properly. Now, what we're talking about when the spleen gets big is sometimes you can have an event called splenic sequestration, which we talked about, and that tends to be that the spleen just suddenly enlarges. And you probably remember being taught when your little ones were very little how to feel for the spleen and thinking, I don't know what I'm feeling for here. But we hope if it gets big, you notice it feels different. The reason being, when that happens suddenly and you get a lot of sickling in the spleen, you can pool a lot of blood in the spleen. It is a big baggy organ. It can get really big, hard, painful, and you can drop your hemoglobin really low, really quickly. It's quite a dangerous thing to happen when it happens suddenly and acutely. And what we do see in children is once it's happened once, the spleen may go back down. It may not go back to completely normal size, but it usually goes back down. But then it's quite common it just fills up again, gets big again. And you might find that it's getting bigger and smaller. Sometimes the hemoglobin is dropping and you need a transfusion at that time. And when you're getting into that sphere, that's when we think, you know what, this is risky for you and it's not doing you much good. So that's when we might think about taking your spleen out. Now, some people live with a spleen that's just a bit big all the time, and it's not really causing them problems. So whether having a big spleen is causing you problems or not is really dependent on whether it's getting very big, whether it means your hemoglobin is dropping and needing transfusions, whether, for example, you are a competitive footballer or want to do trampolining, or something where actually having a really big spleen could be dangerous if you got a whack in it. So all of these things are things that your clinical teams should be discussing with you to think about what's the risk and the benefit of keeping your spleen versus taking it out. Okay, so
Hi. Sorry, ladies and gentlemen, can I have your attention, please, everybody? I started thinking it was the children, and I realized it was the adults. Can we do our best to keep the noise to a minimum, please? I know there are individuals here at the front who are trying to listen to the panel, ask questions, get answers, get insights. So I'm going to be the bad cop now. So I'm going to be walking around the room, yeah? Silence in certain parts of the room, okay? And I'm going to hand back over to Stuart.
Okay, so this is our final 3 questions, and we've got 1, 2, 3. Thanks, Stuart. And anybody else, please do come and find us. I know we didn't answer the eligibility for transplant criteria. Anybody that wants to stay or get their food, do grab. I'm sure Ben is very popular today. I knew he would be, and he's absolutely fantastic. We're very lucky to have him here. So please do grab the panel if you haven't had a chance to ask your questions.
Sorry, I might be coming off topic right now, but
there's no such thing. Anything.
It was just about the schools, basically. Chris, stop, look at me. I think that's been my biggest struggle. My daughter's 6 years old. She's got sickle cell disease. I would say the support from obviously Chris, the hospital, and also community nurse Charlotte. She's been extremely supportive. She has physically gone to the school and given them training, but there has been massive struggles, and I feel like they would probably look at me as the crazy mom, because I'm constantly going to school and saying, okay, it's extremely cold. Why is my daughter playing outside? They're not giving my child an option to actually kind of encourage her friends to be like, oh, would you like to stay indoors with so-and-so? Just to give them something that is not normality, but normality to kids. I try and encourage my daughter and let her know that even though you've got sickle cell disease, you do have options. It can be a positive thing, because this is something that she's going to be experiencing for the rest of, well, not for the rest of her life, you never know, but for the rest of her future. For example, my daughter's biggest struggles is constantly getting illnesses from the school. Recently, she was admitted to hospital because she ended up getting a chest infection, and that's due to them letting her play outside in the rain because they were short of staff. for me, that's a high level of, sorry to use this word, high level of ignorance. And due to the lack of education, they're not taking parents' seriousness. You know, like they're not taking care of my child the same way that I would take care of my child. And I feel like it's extremely important just because your child spends the same amount of time at home than she does in school. They live in school. So I feel like that's what I would say is lacking quite a lot. The school's support.
I would really, really love to harness this, and also your thoughts and ideas about how we can address these things. So when you do, we'll be coming around and doing feedback forms, and we've got them electronically, we've got them on paper. We're asking if people want to be involved in telling us about your experiences, what would help improve things. Because please put yourselves forward if you're interested.
She does have a school care plan, which I think they don't follow. For example,
it's getting it implemented.
I'm constantly having to remind them, like, why is she coming home with a full bottle of water? She should be drinking her water. She's 6 years old. She's not going to be thinking about, oh, I need to drink my water. She needs the adult to encourage her and be like, look, you haven't drunk your water, drink some water. Would you like a banana? Would you like an apple? Because our kids lack high levels of oxygen, so you should encourage them to be, for example, little snacks like that. Another thing is that, you know, my daughter's constantly falling asleep in class because I would call it night shifts. So she's constantly getting up at night to go to the toilet. So when I do drop her off at school, I'm like, look, miss, she's tired today. I don't want her to miss school. But however, do keep an eye on her because I feel she's extremely tired. But then when I go and pick her up, she's like, oh, you know, she wasn't focusing in class. I'm like, it's not really focusing. It's more of, she is tired. She's done a night shift. You know, she's got sickle cell. Just so many things.
So many things. There's so much to think about. Please find us afterwards. Please tell us about your experiences, how you think we can help, what we can do. I'm really mindful of the time and lunch is coming. We've got 1, 2, we've seen you, and 3 here. Anybody that wants to stay, food is being served, but feel free. We're going to carry on with these we've got the last 3 questions, and then, as I said, we'll all be around.
Hi, yes. I've just got 2 points. Just regarding, my 2 boys have EBC thalassemia, so they are blood transfusion dependent. One thing I feel is that when it comes to the support around parents, like a support group, and I've spoken to Chris about this for ages, but I feel like it's something that, especially, I don't see many thalassemia parent or blood transfusion patients that come in. It would be nice for me, it would be nice for the boys, for us to link together, because we have something similar that we can relate to and talk about. It will be nice to go back and talk to people that have the similar or same condition. That's one thing. And another thing I wanted to mention was about DLA, the Disability Living Allowance. I know it's not something that but I just wanted to mention that it's really difficult to get something as DLA. They have come back to me saying I have to reapply for DLA, even though my 2 children, both of them have a lifelong condition. So it's not something that's getting better or it's going away. I know it's not much that we can do right now, but I feel like it's not spoken about. I don't know. I mean, other than Chris and speaking to Dr. Trumpeter, Dr. Tilly, I don't have anyone else.
Well, let me bring Roanna in, I think, here, if that's okay.
Thank you.
So in terms of putting you in touch with other parents, we can certainly do that, and we have a national WhatsApp group, and you'll be feeding into lots of older patients as well. And that's what we find really helpful. What we've tried to do is create this and also in every hospital as well. So for UCH, Chris, I'll need your help, but I think that's been really helpful. And I think I've spoken to you slightly before for a meeting, I think, but so that's one thing that we can help. In terms of DLA, I agree, we shouldn't have to be going through all of this, but one thing we have been doing is we've been training DWP on THAL. So I've written the manuals myself, and I've given them the clinical guidelines and all of that based on the standards of care for THAL. One thing with PIP and things like that, people assume, and I think it's stupid and I don't agree with this, when we write letters as clinicians and things, we'll say, you know, they have beta thalassemia major, they have osteoporosis, they have all of these things. But for the people assessing these applications, they don't care what conditions. You can list 20. They don't care. But what they want to know is how it's affecting every single day in your life. And that's something that we've been trying to train them based on, but also to educate. We've taken quite a big education